Hospital's fiscal year 2024 annual public meeting for the Borough of the Bronx. So before we start the formal program, I would like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359, or in Spanish, 212-788-3359, 212-788-3359. So thank you. My name is Jose Pagan. I'm chair of the NYC Health and Hospitals Board of Directors. And I want to thank you for joining us and would like to introduce the other board members who are here tonight. So we have Dr. Patricia Martone, City Council Representative for Brooklyn. We also have Sally Hernandez Piñero, Karen Sanhilier, representing Molly Wasso Park, Jackie Rowe Adams, and Dr. Mitchell Katz, President and CEO of the corporation. So also on the panel are Andrea Cohen, Senior Vice President and General Counsel and moderator for the evening, and Colicia Hercules, Secretary of the corporation. I would like to acknowledge Jose Ramon Perez Lopez, Director of Constituent Services, representing New York State Senator Jose Serrano, the 29th District, participating in listening capacity. And I would also like to acknowledge the submission of written remarks from Judith Benitez, CAB Chair of Jacobi, in lieu of her oral presentation. So on behalf of the board, I would like to extend our thanks to and acknowledge our Bronx facilities leadership, Christopher Roker at Lincoln, Christopher Mastromano at Jacobi and North Central Bronx, division of Jacobi, and their dedicated staff for providing exemplary service to our public health system and the people that we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. So now I will turn the microphone over to our President and CEO, Dr. Katz, for his remarks.
Thank you, Chair Pagan. I'm Dr. Mitch Katz, and I'm the proud President and CEO of New York City Health and Hospitals. Happy to be in my 7th year and so proud of the amazing work that happens every day at our facilities. We have 9,000 phenomenal nurses, 4,000 physicians and other medical providers, social workers, environmental service workers, and the thousands of people who make this happen. Just looking around the room, I see amazing doctors, I see amazing nurses, I see amazing CAB members and other administrators and the people who make all of this happen. So thank you so much for all of what you do. And we're looking forward to hearing from members of the public and members of CABs about how to improve our facilities and services to be even better than we are. I want to run through a quick list, the highlights of the last year and the things that happened. We opened the Ruth Bader Ginsburg Hospital, which if you haven't seen, you should go by. First new hospital to open up in New York City in 75 years. An amazing statue of her in the lobby. We worked collaboratively with NISNA to get a great contract that we love and our nurses love because it gives pay parity. We continue to care for asylum seekers. At this point, 160,000 asylum seekers have come through our welcome center. We run it, we immunize the children, we get the children enrolled in school, we enroll the parents in healthcare, we make sure that there are no contagious diseases, and then we assign people to housing, and we're very proud of our role doing that. Correctional Health started a reentry service. We now have a lifestyle medicine program in every borough, including the Bronx. All our hospitals serve plant-based meals as the primary choice for dinner. Our NYC Care, for those who cannot afford or are ineligible for insurance, has 125,000 members. We housed 500 people in the past year. Our skilled nursing facilities are ranked at the very top of the list of all skilled nursing facilities, public or private, in the state of New York, with Seaview being the #1 facility in the entire state. We've opened 9 new murals, thanks to the Arts and Medicine Project. We broke ground on a new housing development at Woodhall. We distributed 1 million in debt relief to 27 behavioral providers, which is something I'm particularly proud of. We know that it's challenging for us to hire enough behavioral medicine providers, and being able to offer debt relief increases our ability to hire them and provides exactly the staff we want, those who are similar economics to our patients, people who've put themselves through school despite large debts that they had to incur. We became the first public system to offer telehealth medication abortion services. We have expanded our services for survivors of domestic violence. We are increasingly using the Da Vinci robots throughout our system, including in the Bronx. And then specifically in the Bronx, I wanted to point out that at Jacobi, we've advanced healthcare by using a robot for assisted bronchoscopy. I think there'll be any moment now, there'll be a robot CEO who will give this talk, perhaps better. Jacobi also received Beacon Awards for its cardiac catheterization lab, its neonatal intensive care unit, and cardiac care unit. North Central Bronx received the mammography imaging accreditation from the American College of Radiology as a testimony to its commitment to excellence in care. At Lincoln, they were awarded the Bronx Certification for Excellence in Person-Centered Care from Plaintree International. They too installed a Da Vinci robot, which allows surgeons to perform minimally invasive procedures, gets patients out of the hospital quicker, smaller incisions, less pain. We've been able to get more support for some of the important projects at Lincoln. Congressman Richie Torres gave us $3.2 million toward the new ICU beds, and Councilmember Salamanca gave us $15 million for equipment upgrades and new sterilization equipment. The hospital's MICU too received the Silver Level Beacon Award for Excellence. We've been able also at Lincoln to install new dermatology equipment and working on a variety of beautification and expansion projects. Also great things happening at Gotham. We had a ribbon cutting last week for the 3D mammography machine and bone density scanner at Morrisania, a new bone density scanner also at Belvis. And these new pieces of equipment will provide the kind of high quality screening that people expect from health and hospitals. So again, in closing, I want to thank all of you for coming to the meeting, for being part of this amazing, amazing organization. And I look forward to proceeding to the next part, which our General Counsel, Andy Cohen, will explain how the next part will flow.
Great. Good evening. It's very nice to be here. Let me just spend a moment explaining a little bit about our annual meetings. This meeting this evening is the fourth in our series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of the annual meeting is to inform the public on programs and plans of New York City Health and Hospitals, like you just heard about from Dr. Katz just now. And then very importantly, also to afford the public an opportunity to present testimony, oral or written, about their views, concerns, compliments, or anything else they want to say about New York City Health and Hospitals and the services that it provides. All of the testimony, both what we hear this evening as well as anything that is submitted in writing, will be forwarded to all of the members of our board of directors. But of course, we have a wonderful group of board members here today to also hear it live and in person. Registration for testimony is open for another few minutes, I think. So if anybody has not, yes, we have 10 more minutes. So registration will end at 6:30. But if anybody would like to register to speak, you can do so until 6:30. In terms of just a moment on the rules for the road for the rest of this evening, we are here to listen to members of the public who have registered to speak to the board of directors. It's a one-way conversation, not a back and forth or Q&A. We will just be listening to you and again bringing concerns to other members of the board, either in writing or a transcription of what happened here tonight. In order for each of the registered speakers to have time to testify, they are allotted 5 minutes of speaking time. On the corner of the table over here, and we did make sure it's visible from the microphone where speakers should speak. You'll see an electronic timer. It will turn green when you begin speaking. A yellow light indicates that there are 2 minutes left in your allotted time, and a red light will signal that your time has elapsed, and it will start to blink, and then I will interrupt you, hopefully politely and gently at first, and tell you that you have to conclude your remarks, and you can submit anything else that you have to say in writing. You can submit it tonight. You can submit it tomorrow. Don't worry, we will have an opportunity to hear your views. I'll be calling for speakers and providing the title or association that they provide when they registered. And then I'll also be saying who is the speaker after that so that people can be closer to the microphone when it's their turn to speak. If I mispronounce any names, please forgive me and correct me at the beginning of your time so we know your name. And we will now hear from the first presenter, who is City Council Person Christy Marmorato, if she is here.
She is not here.
Okay. Then the next speaker will be Richard Izquierdo Arroyo, who is the chair of the Community Advisory Board for Lincoln Hospital. And after that will be Jose Etier.
This is for short people. Good evening. My name is Richard Izquierdo. I am the chairman of the Lincoln Hospital Community Advisory Board. I am also the chief operating officer of the Neighborhood Association for Intercultural Affairs, a Bronx-based nonprofit that was founded 50 years ago, dedicated to legal representation, eviction prevention, housing development, homelessness prevention, and housing services throughout New York City. My family and I come from a long history of struggle and community activism in the South Bronx. Currently, the Lincoln Cab is comprised of 19 members, 19 dedicated, advocacy-driven, and professional individuals from different organizations throughout our community, as well as members who are lifelong residents of the South Bronx. As a group, we exemplify a commitment to healthcare accessibility as a fundamental human right through collaborative initiatives and advocacy for improved services in the Bronx. Accessibility to quality healthcare is a crucial aspect of society that plays a significant role in ensuring the well-being of individuals and communities. Through strategic partnerships and advocacy efforts, the Lincoln Cab has made and will continue to make substantial progress in enhancing healthcare services and accessibility in our communities. Collaboration with key stakeholders and strong community partnerships is important to us as a CAB. Because productive outcomes are achieved, we cannot do it alone. An example of such a partnership is the New York City Administration for Children's Services and Lincoln Hospital's initiative, the Family Health Program, to address the healthcare needs of children, youth in foster care, families receiving prevention services. This program highlights the importance of community engagement and advocacy in promoting healthcare accessibility to an at-risk population. Capital investment. With the support of Councilman Rafael Salamanca, Congressman Richie Torres, and several elected officials, the hospital has been able to modernize our facilities and purchase state-of-the-art equipment. This financial commitment underscores the importance of investing in healthcare infrastructure to improve services for the Bronx community. Campus expansion. During the next term of the CAB, which begins in September, we will focus on advocacy efforts on the campus expansion to enhance the delivery of services here at Lincoln for the greater Bronx community. By working closely with the hospital administration and elected officials, The Lincoln CAB will be able to advocate and help ensure funding and support to expand the facility by creating a much-needed 12-story ambulatory care building. Last year alone, Lincoln conducted well over 500,000 ambulatory procedures. We ask for your support to help move this agenda forward and make this capital project a priority of H&H. CAB Retreat. In line with our dedication to advancing healthcare accessibility, the Lincoln CAB has considered key logistical aspects, such as planning a retreat this summer to facilitate strategic decisions and inform the decision-making process. This attention to detail underscores the Lincoln CAB's commitment to continuous improvement and advancement in our mission, in alignment with the vision of Lincoln's administration. In conclusion, the Lincoln CAB, along with New York City Health and Hospitals, stands as a beacon in the fight for high-quality healthcare in the Bronx. Our collaborative initiatives, strategic planning efforts will serve as a testament to our commitment to ensuring that healthcare is treated as a fundamental human right for all people. As we continue to address key topics with the Lincoln administration, such as the strategic plan, community engagement and advocacy, fiscal needs and budget, campus expansion, which I want to stress a little bit to you guys. The Lincoln Community Advisory Board's efforts will help to pave the way for a healthier and more inclusive Bronx community. Thank you, Dr. Katz, Chairman Pagan, and all the members of the H&H Board of Directors for allowing me the opportunity to address you this evening. A special shout out to our very own Sally Hernandez Pinheiro, Chair of Metro Plus, a homegirl who I know holds a very special place in her heart for the Bronx and our community. We look forward to continual collaboration. Thank you.
Thank you so much for your comments. The next speaker is Jose Itier. I hope I pronounced that correctly, the Chair of the Community Advisory Board for North Central Bronx. And after that will be Mariano Laboy.
It's great to follow Richard, who I saw grow up. I'm a product of the original Lincoln Hospital, born in Lincoln Hospital. If any of you are old as me, you'll know where that was. Oh, Dr. Katz, you remember that.
And I'm as old.
Oh. Hello, my name is Joe Ithier. It's a pleasure to have the pleasure of serving as the chairperson for the New York City Health and Hospitals North Central Bronx Advisory Board. Prior to all of that, I was a advisor and representative from Borough President Fernando Ferrer as his chief of staff and as the director of economic development for the Bronx. And I represented the office to all the Bronx hospitals. So I know a little bit about HHC and its hospital. NCB is a community hospital serving everyone in the West Bronx community, regardless of who they are, where they come from, or their ability to pay. We are pleased that in the nearly 50 years, and I will let you know, we have set up a committee that will be celebrating the 50th anniversary of NCB. The 50 years NCB has been in operation. We have served generations of Bronx families who have continued to count on and trust our facility as their home for all of their medical needs. Breast cancer and breast health remain a challenging issue for all New Yorkers, and we are pleased that NCB recently achieved its mammography imaging accreditation from the American College of Radiology, as Dr. Katz alluded to. This accreditation is validation of our staff providing the highest quality and safest care that we can provide to the patients we serve. Additionally, the new tomosynthesis 3D mammography machine allows for our patients to receive highly accurate mammography, testing, and peace of mind. I will interject that just this Saturday, we had Mammo for Mothers as part of our Mother's Day celebration, and the staff was so happy to have that. Last count, when I was there Saturday, we were up to 28 ladies who had come in, and I've been informed that they're still coming into the hospital for testing. Beyond breast cancer, NCB also recently installed a 128 slice GE CAT scanner, a highly advanced diagnostic tool that help determine the disease and injury our patient is suffering from, so we can begin a road to treatment more quickly. These exciting advancements show the investment being made into NCB and the public health system all over, and it's gratifying that our CAB is able to play a small part in making this hospital the beacon that it is to so many within our community. And I want to, in ending, thank our staff, who is fabulous, from Chris Mastromano to Alfredo Jones to the staff. I know some of our members of the staff are here. What a great collaboration between staff and our CAB and the employees at NCB. Thank you.
Thanks so much for your comments. The next speaker is Mariano Laboy, Community Advisory Board Chair at Morrisania. And after that is Amilcar Arnaldo Tirado.
Good evening and welcome to the mainland, Bronx County. My name is Mariano Laboy. I'm the chairperson of Morrisania until tomorrow, because we had new election tomorrow and I will not seek another term. But Mr. Katz, bad news. I will continue being a board member.
We want you.
Please take notice that as a resident of Morrisania session, I object the construction of the residential complex at Morrisania parking lot. It will be detrimental to our community, harmful, but it has been decided by you, the board of directors. Let's hope for the best. I know that 3 or 4 years from now, Morrisania would be better off. On May 22nd, 2024, I forwarded an email to you, Mr. Katz, and to you, Mr. Pagan, in regard to a suspension that somebody in Helen Hospital did against me. I hope that you look into my inquiry. I'm a volunteer, not an employee of Helen Hospital. I feel that that suspension has been illegal. I have been a volunteer for Helen Hospital since 1980. During that period, we had good president, we got figurehead, average president that don't give a quote about Helen Hospitals. But though you, Dr. Mitch, in our opinion, many people said you have been the very best Helen Hospital ever had. Thank you for your vision, and thank you for continuing doing the best for our community. Board directors, you created this brochure. I've been distributed all over the city, and it saves life. Colon cancer is the second leading cause of cancer death in the United States. Please check yourself. 8 years ago, I came to this Lincoln Hospital, and a wonderful Santo of our Lord Jesus, Irizarry, she took care of me. Here I am 8 years later. Thank you, Dr. Irizarry. Don't take it for granted. Please check yourself. What I saw that it was a hemorrhoid. When she consulted me, she said, you have a stage 3 cancer. And she told me, I want to take care of you. And she did. 8 years ago, here I am. We want to thank you, Dr. Irizarry and Lincoln Hospital, for providing me the help that you had done. Last week, I had my checkup, cancer-free. I want to take the opportunity to thank Mr. Izquierdo, chairperson of Lincoln. Mr. Rocker, thank you for your dedication, for making our community best. And a special thank you, I know she's not here right now, to the council CAB chairperson, Ms. Karen Dixon. Karen Dixon will be stepped out for a year because due to term limit. But we hope that she has been doing a fantastic job in our community. We hope that she come back the same way that you had done for our community. Like what Dr. Katz explained last week, we have Mauritania, something new, something innovative. We want to thank you very much. Keep the good work. But Dr. Katz, I'm going to continue to be a board member. I'm going to give her time. Thank you very much. And God bless all of you and the Health Hospital Corporation.
Thank you. Thanks for your comments. Next speaker is Amilcar Arnaldo Tirado, physician at Lincoln Medical Center. Okay, we'll move on to the next speaker. Aronima Mamidi, also a physician with the, you told me this, Isha Foundation.
Good evening, everyone. My name is Arunima. I'm a physician and a volunteer with Isha Foundation, a nonprofit organization dedicated to cultivating human well-being and founded by Sadhguru, yogi, mystic, and visionary. Isha Foundation has been offering tools for well-being from yogic sciences to people from all walks of life. Number of deaths by suicide in United States were record high at more than 50,000 in year 2023, barring the suicide attempts. COVID pandemic pushed the doctor burnout rate to the all-time high of 63%. These numbers are alarming. US Surgeon General calls mental health the defining health crisis of our time. I'm here to talk about inner engineering and present research data on yoga and meditation in achieving inner balance. What is inner engineering? It is a technology derived from the science of yoga. Designed by Sadhguru, it is a comprehensive course of personal growth that empowers you to create your life the way you want it and come to a state of health, joy, and bliss. Inner engineering is a multi-component technique that incorporates cognitive reappraisal, breathing, chanting, and breath watching. Multi-component techniques are highly recommended by the National Center of Complementary and Integrative Health. The coordination between breathing and movement leads to vagus nerve stimulation, which in turn offers many benefits, including emotional mastery and thus joy. Sadhguru's Center for a Conscious Planet is located in Beth Israel Deaconess Medical Center, Harvard Medical School. The three pillars of its function are education, research, and outreach. Our lab explores the neuroscience behind classical yoga. Evidence-based yoga and meditation interventions curated for clinical populations are available online and in person. Wellness programs are tailored for breathing in long COVID, cancer survivors' quality of life, mental health in Parkinson's disease, along with personal wellness programs. Our lab uses cutting-edge modalities to better understand mind-body interventions and catalyze their impact on healthcare, business, education, and other settings. Large population studies have been conducted with outcomes on subjective data and objective data, including blood markers, neuroimaging, and gene expression. 6 weeks of practice of inner engineering in IT professionals showed 50% reduction in perceived stress and decreased negative emotions and increase in sleep quality, positive emotions, relationships, mindfulness, and overall well-being. In a study involving Fortune 500 participants, enhanced joy, vitality, and work engagement were noticed. Results of studies related to basic and advanced meditation programs revealed enhanced memory, alertness, relaxation, inward focus, creativity, problem solving, improved connectivity in brain network, and increase in brain neurotransmitters, neurogenesis, and neuroplasticity. It has also been shown that yoga changes immune response genes. A qualitative study showed increased personal growth and transformation, better communication styles, ability to handle conflicts better, good parent-child relationships. Also noted were qualities of unlocking vitality by dropping bad habits, body transformation, and decreased bodily pain. One can realize these benefits if they practice inner engineering at least 5 days a week. These recommendations are similar to American College of Cardiology and American Heart Association recommendations for physical activity. I am an infectious disease physician, and I did inner engineering in 2020 during the COVID pandemic. Needless to say, my stress levels were high. The uncertainty of the disease trajectory and the lack of treatment guidelines and resources caused immense distress and helplessness. Inner engineering helped me navigate through the pandemic with stability, and continuation of its practice changed my life personally, professionally, and emotionally. This is what the program has done for me and the reason why I'm standing here today. Let's have a joyful journey of life, embracing inner engineering as a guide. Thank you.
Thank you so much for your comments. The next speaker is Nanush Damar Lapali, also a physician from the Aisha Foundation. There another speaker? We had two listed on here. No, it's okay. We can move on to the next. Next speaker is Ronald Colangelo, Vice President of Mothers of 1900 Seminole.
How you doing? So I'm pretty amazed that you would allow pretrial detainees to be stored on a building in Jacoby Hospital. This here, I don't know where Wilton is, but I got everybody a copy of this so you can look along with me as I read. I guess he's someplace else. So now, in this original thing that the Fortune Society gave out, it says that 88 permanently supported units for formerly incarcerated medically complex individuals. Why did it change to pretrial detainees? Did you people read this first? So the problem became that they didn't have enough sick people to get this project off the ground. So, and that I found by going to a sister company of yours, the CHS, Correctional Health Service, that put out a flyer that says, we don't have that many sick people that this project is going to be able to hold. So again, you guys voted for this. It's just great. And now I heard from Sandy Nurse, a city councilman from Brooklyn. She says 50% of the people on Rikers Island have mental issues. She also got that from the CHS. 20% are really bad. So now they're pretrial detainees. Let's let them roam around my neighborhood. Oh, City Councilman Christie isn't here. When she walks out of her house, she can stare at that building. Now, why isn't she here? I don't understand. You know, and I guess she must be upset that I'm here. And I know you all know the late, great Bob Nolan. On December 7th, he gave me a phone call. And he apologized for not really trying to get this project squashed. I said, Bob, I understand. You know, they pay you. You work for them. And he sort of said, well, not for much longer. Okay. The next time I saw him, they were rolling him in a coffin. A week later, out of the church. So he was calling me because he felt bad. I grew up with him. I grew up more with his brother. And he felt sad that he couldn't stop you people from allowing pretrial detainees when the original paperwork was for these massively ill people. So again, I still don't understand it. It's pretty sad that for the sake of probably a few dollars, you're going to let these guys roam around. I guarantee you they'll all get the best dental care. They'll get the best medical care. I was at a CAB meeting. Guy got up millions and millions of dollars spent for the dental department. Woman asked, does it still take a year to see a dentist? Yes. So are these gentlemen going to be able to cut the line? Because, you know, the state money's going to be right there. Whatever they sign down, whatever they sign up, that check will be in the mail for any things that you guys charge them for, which is pretty sad. that you are more worried about making a buck. Bob Nolan also told me, you know, people tell you they're working behind the scenes, but who are they working for? One of the original organizational people that was trying to stop this seems to be able to get the rotunda out of request. And all of a sudden he decided, well, you know, you can't have protests, don't give out flyers. He's even able to lie at the CAB meetings in front of the CEO and everybody when he tried to get Christie on the CAB board while she was running for the Republican nomination for city council. So I went up to somebody and I said, you know, she's running for office. Oh, they told us she's running next year, which was a lie, And they swallow it. They let people lie to their faces and they just, oh, well, you know, what are we going to do? So I find it pretty disgusting that things like this are going on. And again, our city councilman isn't here and she can look out her front door and see this building. So I guess it is what it is, but there's going to be a couple of lawsuits I heard, a couple of other incidents that are going to go on. We had Curtis Wheeler at one of our protests, and he's trying to back us with this. But again, doesn't matter what the people want. It's what the almighty dollar wants, and that's what you're all looking for. A free ride and some good city and state money that'll be guaranteed to show up for every patient of these pretrial detainees, not these medically complexed individuals in their first paperwork, which I don't know what Hilton is. I made a copy for all of you. Then, since the Fortune Society has decided we can get away with that, you know what they put out Thursday? Nowhere to go. New York's housing policies for individuals of sex offender registry needs to be changed.
Would you please conclude your remarks? Your time
So
expired.
again, you can read how the
Thank you.
Fortune Society, let's have some sex offenders running around the neighborhoods because
you
they
for your
have
comment.
nowhere to go.
Thank you very much. Our next speaker is Jilly Delgado, a hospital responder with Guns Down Life Up. Sorry if I got that wrong. Gilly or
Gilly, strong G.
Thank you.
Good afternoon, everybody. Good evening. It's a hard act to follow right there. That's some real stuff. But I got you, brother. But so my name is Gilly Delgado. I am the hospital responder for Lincoln Hospital Gun Violence. Our program is called Guns Down Life Up. We are also associated with the Crisis Management System of New York City. What we do here at Lincoln Hospital, we track all the gunshots, assault, and stab wounds that come in under the tutelage of my director, James Dobbins. Simple example, someone gets shot, stabbed, assaulted, ambulance comes for the patient, police for the crime scene. Our doctors do a wonderful job of patching them up, but who's there for the family? Who's there for the brother and sister that want to retaliate? That's where we come in. We meet our patients at their bedside, and well, we offer them alternatives. One thing we focus on is prevention, intervention, and community mobilization. Prevention, we try to catch it before it hits the streets. Intervention, we have both the after-school program, both summer and winter youth program, where we offer a stipend. We also are an alternative to incarceration, and where the judges give us the kids instead of doing time. We also focus on rehabilitating the human brain, because we obviously know that gun violence is the #1 problem in America and across the world. So after that, we focus on also community mobilization, where we have a team of violence interrupters and outreach workers who canvass a 5-mile radius in the community, offering palm cards and resources for our kids that are outside actively engaging in illegal activities. So behind your seats, as you can see, you have orange T-shirts, which signifies Gun Violence Awareness Month, which is June, where we know that most of the gun violence occurs in June. So that's who we are. That's our pitch. I want to give a strong shout out to Mr. Chris Roca, Dr. Katz, Dr. Fisher, and every staff here at Lincoln Hospital, where it is the busiest trauma center in New York City, and I believe #3 in the nation. And that's who we are. Thank you very much.
Thanks for your comments. So I think with that, unless anyone who was registered to speak came in since we began, I think that concludes our program this evening. Thank you so much for coming and have a safe ride home.